I started coming to the Dartmouth-Hitchcock, to the Spine Center, in 2001. And I came to the Spine Center just because I had such terrible backache and pain down one leg, the left leg. With more visits and I think some more x-rays, they really diagnosed me as the degenerative spondylolisthesis with the sciatic pain down the left leg. Dr. Weinstein asked me if I would be interested in going into a study that they had there at the hospital that would help people with back problems. Probably wouldn't help me, but I have a son that very nicely I passed on my bad genes to. And so I was interested, thinking of him. They are trying to find out whether we get better with the medical treatment or the surgical treatment, so that people that walk in cold, like I did to begin with in '01, have more choice, can make a more knowledgeable choice. What I like about the study is it is so large. So many of them are, just a few hundred people, but where this takes in thousands, you really feel if they're learning something, if you put all those heads together. It just means you fill out a form once a year. They let you know. And now with this phase 2, you can do it on the computer if you have one. I get a big bundle of papers in the mail, and I just fill them out, and same as the questionnaires that we used to do at the hospital in the Spine Center, and send it back. But the nice part of being in the research program is, as I say, when you are having difficulties, when you call, there is always somebody. The whole setup, I guess, is what I'm trying to say, is so very nice and comfortable. I call them my peanuts blanket, or and everyone is so nice, and there's never a stupid question. They have an answer for it, or they make you feel better by the time you get off the phone. It's just, it's a very comforting feeling to know that there are these people there who will help you. With having to get into the project, they put me in randomized, and I came out, the computer chose for me to be a medical patient. A medical patient is you just go along with medications and exercise. And that I actually had been doing for years, because I had medication for the degenerative arthritis, which I had been on for many years. And every doctor that I saw in Rutland and area had a different set of exercises. So it really came out that I could spend my whole day doing nothing but exercises. And I was not feeling any better. But I didn't want the surgery. I really wasn't getting any better. And it was frustrating because I had always run the house and done things the way I wanted to do things. Now I could no longer use a vacuum cleaner. And all those things that housewives do, I could not do. And watching my husband do them infuriated me. The pain got so bad that I went for an appointment, and this JJ, who was one of my, what do I want to say, my blankets to lean on, happened to be there, although I was not scheduled to see her. And I saw her as I was in the waiting room, and I just broke down and cried. And so she got me out of the room, and we talked. And I didn't realize that they were really waiting for me to make the decision. She said, "You're ready for surgery." I had the first Dr. Weinstein, who is the example of patience, loving, gives you a great deal of confidence. Anything he says you feel is okay. He did my first decompression laminectomy in March of that year. March of '01. So, and I was fine right afterwards. It was just beautiful. And then we went on a camping trip in June, my first camping trip, and I had all the, it was with permission that everything would be fine. And all of a sudden, out of the blue, as I stepped out of the canoe onto dry land, the old pain just came right back. Dr. Weinstein does everything very conservatively, and that he needed to go in and do more. So in August, I went in and had what was called the second stage of the decompression laminectomy, and that was it. He makes you feel like you're his only patient, and what your outcome is very important to him, which it is also, but he's working for you to make you feel comfortable, and he always does. We have 4 grandchildren that live in the same town with us, of varying ages, and it was, at one point there was just one of those grandmothers that was like, give me the baby and I'll hold him, because I wasn't able to do things. And then all of a sudden I was the grandmother that I thought I wanted to be. I've learned to snowshoe. I did cross-country skiing, and then due to the arthritis in the hands and all, I couldn't hold the poles. But my back allows me to use my pole. My hands allow me to use my poles, and my back allows me to use the snowshoes. If you keep at it and you don't become the couch potato and let yourself, shall we say, become overweight and become depressed, and just being in the sport program itself just keeps you going and makes you want to be the best you can be. I feel I owe it all to Dr. Weinstein and the sport team. It's been my life for these last 8-9 years.